Welcome to your ultimate hub for pet health essentials. I'm Dr. Reece, and this is my assistant here today, Marie, and we'll be sharing about common respiratory problems in dogs and cats. Respiratory distress usually presents as a persistent increase in respiratory rate, effort, and may be accompanied by coughing or sneezing. In more severe cases, we may get the pet sitting with its head and neck extended to breathe, a blue tinge of the gums, tongue, and even more severe cases, sudden collapse. In cats specifically, persistent open mouth breathing is not a normal clinical sign. Cardiogenic cause of respiratory distress can occur in both dogs and cats, and unfortunately we are now seeing more cases of cardiac disease in younger feline purebred cats, such as ragdolls, British short hairs. However, this can also occur in any life stages in both dogs and cats, and in some dogs, such as King Charles Cavalier Spaniels, they are more predisposed to heart disease. Common inflammatory or infectious causes include feline asthma, chronic rhinitis, and cat flu. And in dogs, we get an infectious kennel cough, which can present as a non-productive, constant cough and may sometimes be self-limiting. With anatomical issues, often the clinical signs can be noted at quite a young age. It is important to discuss the possible treatment options with your vet, which may include lifestyle changes such as weight loss, changes to your household, medications, and in more severe cases, a surgical procedure may be recommended to help reduce the symptoms and improve quality of life. For example, in tracheal collapse, we can perform tracheal stenting, or for BOAS, we can open up the airways. Cardiogenic causes can occur at any life stage. Apart from regular vet checkups to auscultate the heart to monitor for signs of heart murmurs, there is a blood test that we can do to check for heart disease in cats, especially prior to any anesthetics or sedations. If cardiac disease is suspected, an ultrasound of the heart or an ECG may be recommended. Inflammatory and infectious causes can spontaneously occur and may not always be preventable. Being vigilant and keeping track of when it occurs can be beneficial to spot any patterns or trends over time. For dogs, to prevent kennel cough, there is a vaccine that can be given underneath the skin or in the nose to minimize the signs, and should be considered in dogs that interact with lots of other dogs on a regular basis, or dogs that go into dog hotels for boarding. The general advice, regardless of the cause of respiratory distress, is to keep the animal calm in a shaded, cool, and well-ventilated area, and offer sufficient access to clean drinking water. Additional ventilation with a fan may be necessary if the environment is hot. Depending on the severity or duration of the respiratory distress, it may be recommended to seek veterinary attention immediately. Thank you everyone for watching. I'm Dr. Reece. Don't forget to like, subscribe, and share to keep up with vital pet health tips.